Hi, I'm Dr. Mitchell Chasin, Medical Director of Reflections here in New Jersey. If you like this video, please remember to give us a thumbs up and subscribe to our channel. And on the right side of the screen, you'll see valuable links to different resources in the field of cosmetic medicine. Thanks for joining us. Acne and rosacea are very, very common conditions in our population today. And there's something that we want patients to know a lot about early, because early intervention with both conditions can treat things more effectively and prevent some of the complications that we see. So acne affects young people, middle-aged people, people entering menopause, and even older people. It affects women and men. It's a very troubling condition, and the key to treatment is early intervention. Unfortunately, acne can cause a lot of emotional turmoil, but it also can produce lifelong scars. The treatment for acne has changed dramatically through the years. The mainstay of treatment before were long-term antibiotics, and now we know that's just not medically sound. So we now use a combination of topical agents, possibly prescription hormone-blocking agents, and technologies to treat acne. Acne is a very troubling condition and one that is very different to cure because it has many different causes. It may be caused by overactive hormones or just glands that are just too sensitive to a normal level of hormones. It has causes of thickening of the secretions in our skin, bacteria, inflammation, and other factors we honestly just don't understand yet. But our therapies have gotten much, much better. We're using much less oral antibiotic than we did in the past, and that's great. We're using oral hormone blockers, something called spironolactone, that is actually blocking some of the effect of testosterone or male hormone on female skin. And technologies have gotten better and better through the years. So with proper technologies, we're actually able to use less medicines and have longer-term control. Some of the most common technologies are V-beam, smooth beam, isolase, photodynamic therapy. And the newest kid on the block is something called Sebacia. What Sebacia is a specialized topical solution that's applied to the skin. And these microparticles within that solution actually penetrate the skin. And they're absorbed by the oil-producing glands, the sebaceous glands, the acne-producing glands. And in the office, we trigger these microparticles to do what they do by using specialized lasers. And after a series of treatments, just after a few weeks, patients will experience improvement of their acne, and that lasts for months. It's probably been the biggest change in acne therapy in the last 2 decades. Rosacea is a very, very common and troubling condition, and it affects women and men. Generally starts in the 30s or 40s, but people can see it at any age. And what's complicated about rosacea, it has many different forms. One may experience redness or inflammation. Another person may experience dilated blood vessels, what they call broken blood vessels. The next person may experience flushing or swelling of the tissues. And the next patient may experience redness of the eyes. So it doesn't appear the same in each person, and people may have all of those symptoms at the same time. So the therapies are really predicated on what kind of symptoms someone has and what bothers them the most. Therapies have changed dramatically through the years. We started out and all we had were oral medicines. Today, oral medicines are still used, but they're pretty uncommon because we'd rather use proper topical medicines and new technologies. So the topical medicines are important, however, because they can help control inflammation long term. The lasers are anti-inflammatory and they can give us some short-term relief in the inflammation, but they're used more for the dilated blood vessels, more for the redness. In combination, 1 + 1 = 3. So when we see a patient, they commonly have redness and inflammation. And the 1-2 punch of topical medicines plus technology is what yields the outcomes that we're looking for. And the lasers have gotten better. One of the newest kids on the block is called Prima, and that is the latest version of a laser that's been used for over 2 decades called the V-beam. The Prima is now more effective. It is something that is safer to use in darker skin. It It's faster to use, there's less downtime. It's pretty much a better version of the go-to device that's been used for many years. And another one of the really exciting developments is something we call micro Botox. In here, we're using very small quantity, what we call micro droplets of Botox in areas of the cheek, of the forehead, and the chin, sometimes even the nose. And the Botox is able to decrease the inflammation, the redness, and even the flushing. This has represented a major advancement in treatment for rosacea because it enables us to use less medicines in some patients and to complement medicines in others if they're not achieving the results they want. So it's never too late to treat rosacea, but the earlier we treat it, the better. So if you're concerned what you have may be rosacea, please come to our office, sit down for a complimentary consultation where we will evaluate the skin. We'll take a good history. We'll ask if there's rosacea in the family. We'll ask about your symptoms and what you see. And then we'll determine what's the best course of action, whether it's topical therapy, whether it's oral therapy, whether it's lasers, or it's a combination of all three. We're going to design a treatment program that works for you. And you should see that redness and inflammation respond predictably. And patients get really happy when they've experienced this redness for years and years and years, and now they see that just recede. They're more comfortable in social situations. They're more comfortable dating. They're more comfortable within.